Well, hello everybody. It's Dr. Carmen Bryant with Car Chronicles. I'm back in the car, y'all. Kiddos went back to school, so I'm back in my car. I'm your host of Overcoming Narcissistic Abuse. You guys ready? Let's do this. Question has been asked, is narcissistic personality disorder a mental disorder? And the answer to that question is yes, it is. Let me explain something to you. So mental health providers, psychiatrists, psychologists work from a manual called the Diagnostic and Statistical Manual of Mental Disorders. We are currently on the 5th edition. Prior to the 5th edition in DSM-4, we used to operate with what is called Axis. Those of you in the mental health industry or mental health field remember when we used to operate off the multi-axis, where there were 5 domains that a person was diagnosed on. The first domain, the axis 1, clinical disorders or clinical disorders, which is psychiatric disorders. And the term psychiatric means disorders of the mind. So axis 1 through 5, but when you're dealing with mental disorders or mental health disorders, psychiatric disorders, you're dealing with disorders of the mind. So axis 1 was the clinical disorders, which encompasses major depression, post-traumatic stress disorder, autism, different disorders like that. Axis 2, psychiatric disorders were long-standing and chronic. You consider chronic and usually presented before the age of 18, but is not diagnosed until after the age of 18. These are your personality disorders or mental retardation. It's not called mental retardation now in the DSM-5, but they were the mental retardation and the personality disorders. Personality disorders are long-standing with pervasive patterns of thinking and behaviors which are present before the age of 18 but are not diagnosed until after the age of 18. These are not episodic, these are chronic, and usually the personality is not fully formed until after the age of 18. Axis 3 would be your physical and medical conditions. Axis 4 was your environmental or psychosocial issues such as homelessness, joblessness, divorce, life events, things that happen in the environment. Axis 5 was your global assessment of functioning, meaning the scale from 0 to 100 was how people were functioning in the disorder or with the issues that they were having. Personality disorders are distinct mental illnesses defined by dysfunctional personality traits. Go to part 2. Hey, Dr. Carmen Bryant, Car Chronicles, and this is part 2, is narcissistic personality disorder a mental disorder, is a mental illness. It is a psychiatric disorder, a mental illness. What is a personality disorder, which originally in the DSM-4 was on the axis 2. Remember, go to part 1 so that you can catch up for part 2. But originally on the axis 2, it is a personality disorder, and we talked about, is a distinctive psychiatric illness, and is distinctive because it has dysfunctional personality traits. And so now let's talk about what is a personality. So a personality is very distinctive to each person, and it's a cluster of characteristics and qualities that creates a person's character. So your personality is your character. So when you're talking about a personality disorder, you're talking about a character flaw. A disorder in the character is a character flaw. There's a disorder or illness in the character, in the personality, which is permanent. And when you have a disorder in the personality, it is chronic and it is permanent. And in school, in the master's program or in your graduate programs, you learn, and we learned when we were dealing with the axis, that a personality disorder is permanent. You can't change it. Usually what you're working with the axis 1, which is the clinical disorders. But a personality is permanent, and a personality disorder is permanent. So you have 3 different types of personality disorder. You have cluster A, cluster B, and cluster C. Cluster A is it is the odd eccentric type of personality disorders. They're classified as odd and eccentric. These are your paranoid personality disorder. These are your schizotypical personality disorder and your schizoid personality disorders. Cluster B is your dramatic personality disorders. dramatic and erratic behavior. These are your narcissistic personality disorder, your borderline personality disorder, your histrionic personality disorder, and your antisocial personality disorder. Once was you would know them by, let's see, a psychopath, sociopath, but antisocial personality disorder. These are your dramatic, erratic behaviors. Cluster C personality disorders are classified by anxiety. These are your avoidant personality disorders, dependent personality disorders, and obsessive compulsive personality disorder. Now, there's a difference between obsessive compulsive disorder versus obsessive compulsive personality disorders. So that's your cluster A, B, and C. So you see cluster B is where narcissistic personality disorder falls into that category. Those are your dramatic, erratic behaviors. Those of you that are aware of narcissistic personality disorder and people with that disorder, it classifies them very well. That's where they fall in. So the answer to your question is yes, it is a psychiatric disorder.